US health insurance system. Information about the US healthcare system, getting health insurance for non-citizens and health insurance options. How does the US health system work? Healthcare in the United States is organized in a complex bureaucracy. While in the rest of the world healthcare facilities are owned mostly by the governments by or by private sector businesses, in the US a large share of hospitals and clinics are owned by the private non-profit organizations. Yet the United States is the country that has the highest healthcare expenditures in the world. While these expenditures are covered in a large share by public payers as by federal institutions or state and local governments, they can also be covered by the private insurance and individual payments. At the same time, unlike most developed nations, the US health system does not provide healthcare to its entire population, as there is no single nation wide system of health insurance. The United States primarily relies on employers who voluntarily provide health insurance coverage to their employees and dependents. In addition, the government has programs that tend to cover healthcare expenses for the fragile parts of the society as the elderly, disabled, and the poor. These programs differ from one another and all have a specific kind of people that are subject to. Getting health insurance in the US is not an easy thing. Sometimes may think that once you have money everything is easy peasy, but in fact they are a bit more complicated. But one must be very careful and look out to pick the right insurance. Health insurance in the United States for non-citizens. The United States government does not provide health insurance for all its people, and health insurance not obligatory for those living in the US. It is optional but highly recommended and necessary since health insurance services are very costly, more than in any country anywhere across the globe. These are two types of health insurance in the US: private and public. Most people use a combination of both. The US public health insurance are Medicare, Medicaid, and Children's Health Insurance Program. Medicare is a national health insurance program that dates back to 1996. It provides health insurance for US nationals older than 65 years old, but also for younger people with end stage renal disease, ALS, and some other disabilities. Data shows that in 2018, Medicare provided almost 60 million individuals with healthcare in the US, over 51 million of which were older than 65. The Medicare program is divided into four parts. Part A, which covers hospital, skilled nursing, and hospital services. Part B covers outpatient services, including some provider service while inpatient at a hospital, outpatient at hospital charges. Part C is an alternative called Managed Medicare, which permits patients to select health plans with at least the same service coverage as Part A and B. Other benefits of Part D and another annual out-of-pocket spending, which is an B to sign Part 1 by cover mostly self-administration prescription drugs. Medicaid is a federal and state program that helps people with limited income and resources to cover medical costs while covering benefits normally not covered by Medicare, as nursing home and personal care service. It is the largest source of funding for medical and health related service for people with low income in the United States. Data shows that the US provided health insurance to 71 million people without income or disabilities, which is 23% of the